Welcome to the training on Trauma-Informed Care, presented by Heather Bielik, Mary Booth, Laura Davis, Chandler Hoppel, Tabitha Tayala, and Tiffany Sedlacko. Prior to viewing this training, you should have received and completed the pre-test on Trauma-Informed Care sent to your email. The following presentation is a recording and can be viewed more than one time. All the links are live and available for your review.
All right, so what is trauma? First, I'm going to break down trauma for you and exactly what it is. The definition of the word trauma is any event that has a lasting negative effect on the self or psyche. Trauma can also be defined as anything that an individual considers traumatic. Usually directly following a traumatic event, shock and/or denial are the norm. Long-term reactions may include unpredictable emotions, flashbacks, difficulties with relationships, and physical symptoms such as an upset stomach, sweating, or high heart rate. Now on slide 3, I'm going to talk about the types of trauma. So there are two types of trauma. The first is big T trauma and the second is little t trauma. And each one has a different meaning. Big T describes more dramatic types of trauma such as violence, war, murder, rape, robbery, or physical abuse. There are larger scale events that would be easier to identify as a traumatic experience. Big T trauma can be one single event like a robbery, or it can be a series of traumatic events like physical abuse. Little t trauma, on the other hand, are highly distressing, smaller events that affect individuals on a personal level, but don't necessarily fall into the big T category. These include life-threatening injuries, emotional abuse, bullying or harassment, loss of significant relationships, divorce, or death. If any of these events cause a long-term negative effect on the individual, then they can be categorized as a little t trauma. Since not all people experience events the same, one person who goes through a little t trauma may not be affected. However, others could be drastically impacted to the point where they can't cope properly in their everyday lives. So next, I'm going to talk about trauma-informed care. Now, by being trauma-informed and having a trauma-informed school, there must be positive relationships among the staff and students, as well as a safe environment within the school. In order to implement trauma-informed care, there are a few steps that must be put into place with every staff member involved. First, you must realize the widespread impact of trauma by understanding what it means and the effects it can have on someone's life and overall well-being. Next, you must be able to recognize the signs and symptoms of trauma by learning what to look for in children, adolescents, and even staff, so you're able to assist them by using a trauma-informed approach. Finally, you must respond by fully integrating knowledge about trauma into policies, procedures, and practices. Different ways in which you would be able to do this would be by working with administration, teachers, and other staff to understand the tools as well as the value in a trauma-informed approach. You may also work a trauma-informed approach into school policy and into classroom settings. There are many ways in which you would implement this, but it all varies on the school in which you work.
In this short video, Dr. Daniel Siegel uses a hand model to describe the brain.
One of the most rewarding experiences for me has been to study brain science and apply it to the experience of parenting. And the hand model of the brain that I use to teach parents is very useful to understand that. So if you take your thumb and put it in the middle of your palm, put your fingers over the top, this is a very useful model of the brain. And when we can actually see in front of us what's going on in the brain, then we can change what the brain does. So let me walk you through very basically what happens in this brain and the structures in it. And it goes like this. The spinal cord comes up representing the wrist, and then you have coming up into the skull, the brain stem and the limbic area, which work together to help regulate arousal and your emotions and the way you have a fight, flight, freeze response. These are below the cortex, the limbic and brainstem areas, and the cortex is this higher part of the brain that allows us to perceive the outside world, to think and reason. And this frontmost part of the brain, right behind your forehead, so the person's oriented like this, is actually the part that regulates the subcortical, limbic, and brainstem areas. This regulation is very important because sometimes we can have all sorts of things happen in our life. We're tired, we're exhausted, someone pushes a particular emotional button, and we can flip our lids. So rather than being tuned in and connected and balanced and flexible, we can lose all of that flexibility, even lose moral reasoning, and act in ways that are terrifying to others, including our children. Now, you can actually bring yourself back online and come back to the high road and make a repair with your child. And that's important to explain to them. And you can also use this hand model of the brain to explain to children, even as young as 5 and 6, how to understand when their emotions are rising up from the brainstem and limbic areas here, and how it's overriding the prefrontal area and making it so they may be about to flip their lids. So I've had kids come tell me that they're about to go flip their lids and they need a break. They need a timeout. And by even just naming that, they can tame it. And that's the power of using the hand model for ourselves and our children to help us all make sense of what goes on in the emotional communication that we have in the course of day-to-day life.
Brain development. The spinal cord routes messages from the brain and is responsible for automatic brain functions, which are sometimes called reflexes. The brainstem is the oldest part of the brain. It communicates with the body and regulates things such as the way we breathe and our heartbeat. The brainstem gets involved when we are scared to create a reactive state. This state is known as the fight, flight, or freeze and will be discussed in a later slide. The limbic system is the emotional brain. It works with the body to motivate, appraise the meaning of things, and regulate emotion. It is responsible for the fight, flight, or freeze reaction. The cerebral cortex, or thinking brain, is involved with how we use reason and perceive the outside world. It basically makes maps of the outside world using our eyes and sounds. And the prefrontal cortex is involved in impulsivity, decision-making, and integration. It integrates the areas of the brain to work together to create harmony for the body. This part of the brain is the last to develop and does so around the age of 25 in males and 21 in females. Early childhood trauma and early brain development. Trauma creates a series of events. The trauma happens causing the limbic system, which is the emotional center of the brain, to release hormones. Through the fight, flight, or freeze response, the brain learns ways to respond to the trauma. The child physically grows, but is emotionally stuck at the point of trauma. The trauma quite literally stops the emotional development of the child right when and where the trauma happens.
The Adverse Childhood Experiences, also known as the ACEs, is a 10-question assessment that was developed by the Center for Disease Control and Prevention and Kaiser Permanente by collecting health information from more than 17,000 members in Southern California. Using data from the study, they were able to predict health outcomes based on the frequency of answers to questions. The 10 areas of the ACE assessment look at abuse, emotional, physical, and sexual, neglect, physical and emotional, and family dysfunction, family mental illness, physical abuse of mother, divorce, incarcerated parent, and substance abuse in the family. Experiences that are out of the control of the child that occur early in childhood have a lasting effect. Children learn healthy coping skills through secure attachment, and when that is disrupted, children do not develop an appropriate internal locus of control. If the child or adolescent has not built an internal locus of control, rather they have a history of abuse or neglect, a child will have a difficult time overcoming struggles without caregiver or educator knowledge of why the child is responding the way he or she is and adjusting their response. Vander Kolek, 2014. You receive 1 point for each type of trauma on the ACE assessment. The higher your ACE score, the higher your risk of health and social problems. As your ACE score increases, so does the risk of mental health problems, disease, social and emotional problems. With an ACE score of 4 or more, things start getting serious. At the conclusion of this presentation, we encourage you to return to this slide to take the ACE assessment for yourself. In a brief issue studied by Johns Hopkins Bloomberg School of Public Health in October 2017, they looked at a national and across the state data of ACE data among US children. Among the findings, ACEs are common across all groups and among children with both public and private insurance. 58% of U.S. children with ACEs, however, live in homes with incomes less than 200% of the federal poverty level. Black children are disproportionately represented among children with ACEs. 6 in 10 have ACEs, and they represent 17.4% of all children in the United States with ACEs. Compared to those children with no ACEs, children 3 to 5 years old with 2 or more ACEs are 4 times more likely to have 3 or more of the 6 social and emotional challenges that affect learning. About 2/3 of children 6 to 17 years old who bully, pick on, or exclude other children, or are themselves bullied, picked on, or excluded, have an ACE. Nationally, 21.7% of the children are estimated to have 2 or more adverse childhood experiences, with individual states ranging from 15% to 30.6%. 11 states have significantly higher numbers of children with 2 or more ACEs, including Montana, Arizona, New Mexico, Oklahoma, Missouri, Arkansas, Louisiana, Mississippi, Alabama, Kentucky, and Ohio. Care should be exercised when using the ACE assessment in the classroom or other environments for several reasons. You may need permission from a child's parent or guardian to administer it, and there can be legal constraints that should be adhered to. Additionally, if you are not prepared for or able to address the results of the assessment, it's probably not a good idea to uncover them. In some situations, school counselors administer the assessment anonymously to get a sense of the situation within a population without specifically identifying individual status. This can help determine the level of trauma present and steps that can be taken to address it in a school.
When a student is behaving in an abnormal way, it may be the student's means of communicating that he or she has been through or is currently going through trauma. Our reaction to trauma often manifests as a flight, fight, or freeze response. Symptoms of flight include withdrawing, such as putting head down, skipping class, daydreaming, dissociating, seeming to sleep, avoiding others, hiding or wandering, and an example in a school would be hiding in a bathroom. The fight response is often viewed as the most disruptive and includes acting out, behaving aggressively, defiance, hyperactivity, screaming, arguing, and throwing things. The freeze response can be mistaken for shyness and is often overlooked and includes exhibiting numbness, refusing to decline to answer, refusing to get needs met, giving a blank look, and feeling unable to move or act. Students experiencing a wide range of trauma from big T to little t can exhibit any of these behaviors at any given time in a school day. When students exhibit any of this behavior, they have historically been asked, "What is wrong with you?" However, because these behaviors are a direct result of unresolved or current ongoing trauma, what has happened to you is the more appropriate question to ask oneself when working with these students. From here, the behavior can be resolved therapeutically with a mental health professional, ideally treating the deeper issue, thus extinguishing the behavior once the student learns to cope with the trauma.
Okay, so schools have academic and behavioral expectations that can be extremely challenging, if not impossible, for children who have experienced trauma. To help them become more successful in the school environment, it is our job as educators to change our perspective of all students. Here we have a chart of 2 different perspectives in the school setting. On the left side, we will review the traditional, more common perspectives, and on the right side, we have our trauma-informed perspectives that we will try to strive to utilize. There are many examples to show the difference. I chose a few common ones. In the past, school staff put their focus on academics. Well, now we want to focus on the whole student growth and well-being, meaning there is more to helping the student become successful, so we should look at their social emotional needs. Students may respect authority. Although some of us may agree with this, our new mindset is that we should choose to respond to students respectfully because we are a model for them. Modeling this behavior will teach them to respect you. The next one, blames drug crisis, poverty, and blames parents. These factors influence the student negatively, but we should really focus on the things that we cannot that we can control. And again, modeling these expectations, expected behaviors in the school setting is really important. The next one, there is no hope for the student. He or she will never make it. I don't know about you all, but I have heard this many times. This should not be our mindset. Resiliency can be learned, and it can start in a school setting with you. Being aware that coming to school is a form of resiliency shows that the student is trying. Therefore, if we foster a safe and more comfortable environment for our students to be in, it can improve them to help them bounce back and come back to school to be more successful. Students should easily adjust to changes such as having a substitute teacher or changes in the schedule. Even though this is easy for us to say and think, it may not be easy for our kids who have experienced trauma. Change may even be triggering for those students, and their stress response may be alerted, which is the fight, flight, or freeze. So in order to avoid that, we need to communicate with our kids ahead of time and tell them what they can expect and provide them with ways to cope with this change. These mindsets cannot be changed overnight. This is something we will all work towards to be more aware of our thoughts regarding students and student behaviors. This is essentially the first step we need to make when working with children who experience trauma.
We all have our own purpose in this world. Each one is unique and different from everyone else. As educators, most of us say our why is to be able to make an impact on our students' lives. Even though we might all have the same goal, each of us has traveled a different path to get here today. Knowing your personal why can help you continue to stay focused, feel passionate, and gratified in your career. We are now going to present you with a short video to help you better understand your why and your purpose in life. Michael Jr. is a comedian who uses his shows to take his time to talk to his audience and give an impactful speech. Please enjoy the following video.
How do I know? A lot of people, when they think of the phrase, how do I know, they always want to put the what behind it. How do I know what I'm supposed to do? The question that you really should ask is, how do I know why I'm here? Because when you know your why, your what becomes more clear and more impactful. If you know, like for instance, people know that I do comedy, but that's what I do. My why is to inspire people to walk in purpose. So I can do comedy, I can write books, I can be in a movie, because all of it is motivated by my why. In fact, I have a new web series out called Michael Jr. Break Time. We probably just did the 6th episode. It's on YouTube. So every single Wednesday at 3 o'clock, we drop a new episode on YouTube of Michael Jr. Break Time. What it is it's me. I travel around the country and I do stand-up comedy, in case you didn't know. And in the middle of my comedy set sometime, I'll stop and just talk to my audience. And we've been filming this, and it's pretty cool. So we're in Winston-Salem. I'm gonna show you a clip from Winston-Salem. And I'm just talking to this guy in the audience, and he tells me that he's a musical instructor at a school. So I was like, all right, you're a musical instructor, can you sing? Let me hear you sing a song. So this is what happened at the last episode of Michael Jr.'s Break Time. Check it. So you're a musical director.
Yes, sir.
All right, so let me get a couple bars of like Amazing Grace. Can you do the first part of that? Go ahead.
Amazing grace, how sweet the sound that saved a wretch like me.
Wow, that bro could sing. You know what I'm saying? All right. Now, once you give me the version, as if your uncle just got out of jail, you got shot in the back when you was a kid. I'm just saying, let me see the hood version real quick, if you know which version I'm talking about. Just see if that exists. Let me see what you got.
Amazing grace, how sweet the sound that saved a wretch like me. sweet. Here's what I want you to catch. The first time I asked him to sing, he knew what he was doing. The second time, he knew why he was doing it. When you know your why, your what becomes more impactful because you're walking towards or in your purpose.
Throughout this presentation, we have informed you about the purpose of trauma-informed care. At some point in our careers, we are all going to deal with a situation where trauma-informed care can be beneficial. Some of us may have been in the situation already. Others may have had no experience at all. In the current situation of the world today, some of us could be in the trauma situation as we speak. How can you use what you've learned today to make a difference in your careers? You have been involved in work. If you've been involved in working in trauma situation, what can you do differently for the next time? If you have no experience, what can you take from today? If you are currently in a trauma situation, how can this help you now? And of course, how can this information from today incorporate with your why? Each day is a new opportunity to make a difference. We hope that the information from this presentation will assist you in making an impact on your students' lives. We would like to thank you for taking the time to watch this presentation. You will be receiving an email with a post-assessment and to fill out. Please do that for us. We would like to thank you again and hope you stay safe and healthy.